These are the three critical factors in a good aesthetic crown lengthening. Soft tissue management, which entails incision design and flap reflection. Osteoplasty, which entails thinning of the thick buccal cells of bone. And ostectomy, which is removal of the supporting bone. These three critical components will determine whether a aesthetic crown lengthening is successful or not. Especially long term, there is a risk of relapse. When we have a gummy smile, there is always a risk of relapse. Osteoplasty is a critical component. Proper osteoplasty is critical to make that aesthetic crown lengthening last long term. If the osteoplasty step is not properly done, there is a good risk of relapse of your aesthetic crown lengthening, and the patient will complain from a rebound in that excess of gingival display. These three critical components must be mastered in any good aesthetic crown lengthening. If you have any questions, leave your comments below, and please follow me on my YouTube channel. Many professionals don't place enough emphasis on the osteoplasty process, which is, to me, as important as the ostectomy. Two separate aspects of the surgical procedure as important. The type of suturing that I like for an aesthetic crown lengthening is either an internal mattress or a single interrupted. Definitely I try to minimize the trauma to the tips of the papillae, of the new papillae that you have created in your incision design. During the initial healing time, especially the first month, it is critical that the patient has good blood control. We should give specific oral hygiene instructions to our patients after an aesthetic crown lengthening to avoid any trauma to the anterior areas, especially during the first initial 4 weeks of healing. The first 4 to 6 weeks of healing are especially critical because it's during the time when the connective tissue is attaching to the root surface. Histological data has shown that the formation of a new biologic width takes place during the first 4 to 6 weeks of healing after reflecting a flap. That is why we need to inform our patients to be especially more careful with their plaque control. The oral hygiene brushing technique has to be more gentle during this initial 4 to 6 weeks of healing. So remember the difference between osteoplasty and ostectomy. In the osteoplasty process, we are thinning the thick horizontal component that many of our gummy smile patients have. So we need to do proper thinning in order to prevent for a relapse. The ostectomy entails removing some supporting bone around the perimeter of the tooth. Sometimes it is only necessary to do an ostectomy on the buccal aspect. Sometimes it is necessary to do an ostectomy around the full perimeter of the tooth, depending on the case. If a provisional phase is required, it is of utmost importance that those provisional restorations are highly polished to speed up the healing process. The moment we perform an ostectomy, we need to be more patient and wait for the re-establishment of a new biologic width, connective tissue attachment, and junctional epithelium. However, that biologic width is not fully mature. If we rush to take impressions for the final restorations within the next 2 to 3 months, there is a risk of recession as a result of immature biologic width formation. When we perform an ostectomy around the full perimeter of the tooth, it is recommended to wait for maturation of that biologic width with the provisional restorations for a good 4 to 5 months. That is why in making those provisional restorations, make sure that they are of high quality, highly polished and of high quality. It has been recommended to wait up to 6 months with those provisional restorations every time we do an anterior crown lengthening to prevent any risk of recession as a result of the use of retraction cords that could lead to a premature recession as a result of the trauma from using those retraction cords. We need to understand that a retraction cord can cause some trauma to a biologic width that is in the process of maturation. So that junctional epithelium and connective tissue attachment will need to mature for at least 4 to 5 months before final impressions can be. In performing our ostectomy, we have to keep in mind that we want to leave about 1 millimeter for the new connective tissue attachment, another one for the junctional epithelium, and about 1 or a bit less than that for the sulcus. So from the osseous crest to the CJ, we want to leave at least 2.5 to 3 millimeters of room for that new biologic width to be established. The typical gummy smile patient will have an excess of gum tissue, gingival tissue, as well as bony tissue. So we'll need to focus on providing crown lengthening based on the excess of gingival display and the excess of bony architecture. One thing is for sure, if well done, aesthetic crown lengthenings will change the life of our patients forever. They will love you for it. We have the power to transform the life of our patients and help them regain the confidence and self-esteem that they may have lost as a result of having a gummy smile.